Okay. A hearty good afternoon and welcome to the session on fibroids and fertility. We are glad to have Dr. Mangala Gowri among us today to help us understand the topic. She will take us through that and more in this session today. Doctor, you have the stage.
Good afternoon, all. I'm Dr. Mangala Gowri, fertility consultant and IVF specialist. And I do work at Apollo Fertility, RR Nagar, Bangalore. Today, I'll be talking about fibroid and fertility related issues. Uh, Fibroid is one of the most common gynecological conditions seen in the women of reproductive age group of 20 to 45 years. The incidence is about 20 to 30%. It is very common, in fact. We do see fibroid in one in every seventh or eighth woman who come to our hospital seeking for fertility treatment. So it is very commonly seen in women, and it is nothing but a smooth Yeah. Depending upon the location, there are three types of fibroids. First one is the submucous fibroid, second one is intramural fibroid, and the third one is subserous fibroid. Submucous fibroid, basically, it is very near to the cavity of the uterus, which is mainly related to fertility problems. They do cause fertility problems, but luckily they are not that common, which constitutes only about 4 to 5% of all the fibroids. Second type is intramural fibroid, which is confined to the body of the uterus, and sometimes it can also cause fertility issues. But the third one is the subserous fibroid, which is also very common, and it doesn't cause fertility related issues. And most of the time, they present with gynecological symptoms like pain in the abdomen or heaviness in the lower tummy, or they may present with mass in the abdomen. So we mainly concentrate on the submucous fibroid and the intramural fibroids, and among this, intramural fibroid is most common. So when we come to the fertility issues, how they do cause the fertility problems. First of all, these submucous fibroids, when they are situated just above the cervix, blocking the internal opening of the cervix, or when it is near to the tubal opening of the tube into the uterus. In that cases, it may obstruct the transportation of the sperms or the eggs or the embryos. That's how it delays the conception, delays the pregnancy. And if it is anywhere situated near the tube, if the fibroid is situated near the tube, most of the time it can affect the motility of the tube. That's how it hampers the transportation of the sperms and the embryo from the tube into the uterus. Basically, the submucous fibroid, when they are situated in the uterine cavity, they delay the implantation of the embryo in whichever the method of the conception, whether like a natural cycle or in TI cycle or IUI cycle or even in IVF conception. This embryo implantation will be hampered when these embryos goes and sits on these submucous fibroids. Sometimes it can increase the chances of abortion also when these embryos are implanted on this kind of submucous fibroids. When we look at intramural fibroids, it mainly depends upon the size of the fibroid and how far it is situated from the inner lining of the womb. Usually, the fibroids which are more than 3.5 or 4 centimeter, or when their outer margin of this fibroid is very much near to the endometrium. In that case, the blood supply to the endometrium will be altered, and that's how it reduces the chances of embryo implantation and increases the rate of abortion. So it all mainly depends upon the size and the number of intramural fibroids. And as I told you before, subserous fibroids usually does not cause any fertility issues. And if at all, if subserous fibroid has to be removed, it is for some other gynecological problems, not for the fertility related issues. Mainly, these types of fibroids are diagnosed on the scan, ultrasound scan, and number location they can be exactly made out on the 3D pelvic scan, 3D or 4D pelvic scan, but rarely MRI may be required when the fibroids are situated in the unusual locations. So many couple, they come to us as asking a question: I have fibroid. Do I have any fertility issues because of the fibroid? Do I really require surgery? But what I would like to tell, it mainly depends upon the type of fibroid and number of fibroid and the location of the fibroid. So the type, number, and location are the determining factors whether they really require intervention or not. So usually most of the time these submucous fibroids require surgical intervention, wherein if they are located just above the cervix and blocking the internal opening of the cervix, or if it is situated near the uterine opening, or if it is situated anywhere in the uterine cavity, most of the time that has to be removed to increase the chances of embryo implantation and increase the chance of pregnancy rate. Most of the time they can be removed hysteroscopically, which is what we call it as hysteroscopic myomectomy, wherein the patient will get admitted in the morning and they get discharged by evening, and it's quite safe procedure and simple procedure. But if it is a intramural fibroid, then definitely we have to see what is the size of the fibroid, what is the how far it is situated from the inner lining of the womb, and number of these intramural fibroids. If they are more than 3.5 to 4 centimeters, or if the outer margin of the fibroid, as I mentioned, if it is very much near to the inner lining of the womb, that is endometrium, then it is better to remove such kind of fibroids to increase the implantation rate, embryo implantation rate, and reduce the chances of abortion. And if it is a multiple fibroid also, most of the time we recommend removal of fibroids as much as possible to increase the pregnancy rate and to avoid the complications during pregnancy. And subserous fibroids, most of the time they do not require any interventions for fertility reasons. So overall, I would like to tell that not all the patients require surgery. Most of the time they can be removed if there are multiple fibroids and there are subserous fibroids, then they can be removed So overall, I would like to mention that not all the patient with fibroid require surgical intervention, or they do not require treatment, but treatment is definitely required in some women in indicated cases to increase the chances of pregnancy rate. Thank you.